Guaranteed Plan for Preventing Breast Cancer and Hysterectomy. Introduction. One thing we all have in common is the fact that for each one of us, life is an adventure made up of the choices and the decisions we make along the way. Some of these choices and decisions are based on accurate information, while others are based on inaccurate information. Yet, every once in a while, we make a decision that years later proves to be extraordinarily beneficial. About 40 years ago, I made such a decision. I don't believe I had enough accurate information at the time to make the decision that I did, but I now realize that in my state of limited information, I allowed intuitive guidance to assist me in making an important decision. I had begun studying naturopathic principles out of personal interest. Then, after several years of personal study and observations, I came to the realization that somehow degenerative disease was developing out of control, and the world of natural therapeutics was almost as clueless about why this was happening as the medical world. So, after observing this, I decided that rather than spending my time studying the information that obviously wasn't working, I'd go to the front lines of the real world and learn from those who were successfully impacting the health of others. My real education began while I was directing one of the cancer clinics in Mexico. From working with so many very ill people, I discovered the questions that needed to be answered. I then launched a very diligent 30-year research project to find these answers. As I now look back over what I've learned down the path that I chose, I see clearly that it would have been impossible for me to possess the information that I've collected if I had followed any of the traditional paths of study. If I would have chosen any of the traditional paths of learning, I would have had profit-generating corporations and associations preparing me to become a part of the greatest money-generating machine this world has ever known, the health and disease industry. Although it may not be openly discussed within this industry, the primary objective isn't to bring a person to actual solution, but to develop a financially lucrative practice or business. In place of learning how to make lots of money, I was able to discover information capable of freeing people from the pain and the suffering of aging and degenerative disease. Now, before I share my deepest feelings regarding the reality of health and disease, I would like to ask you one very simple question. What form of treatment does a perfectly healthy person require? That's right, a perfectly healthy person doesn't require any form of treatment. Once you see this vital point, it will then be easier for you to see why hundreds of millions of dollars are spent annually promoting drugs and supplements, but nothing is being spent promoting the sale of carrots and spinach. If everyone followed the steps necessary to create a state of perfect health, there would be no need for the health and disease industry. My name is Mick. I'm a naturopathic doctor as well as a doctor of divinity. Now, the reason for my aligning these two sciences in my professional life is because I believe there exists a perfect alignment between true spiritual health and the health of the physical body. But for the reasons already presented, I chose to be a teacher and counselor rather than a licensed practicing physician. I teach individuals like yourself how the human body really functions and how you can support the innate wisdom of your body to heal itself and to actually create a level of health where disease cannot even exist. If you are willing to take that responsibility and to discipline yourself to create such a level of health, you can finally stop playing the game of illness. The game of illness is the most expensive and life-threatening game in town. This is the game that is played by treating the symptoms of disease while leaving the reasons disease develops untouched and firmly in place. One of the side effects of playing the game of illness is the fact that you are paying out large sums of money while mistakenly believing that you are being assisted in solving your health problems. Another exciting thought I would like to share with you is this. If you were to create a high level of health and greatly increase your energy levels and your feelings of well-being, the natural wisdom of your body would actually be capable of healing almost any condition that may have already developed within your body. Then, all healthy treatment that you would incorporate with your healthy lifestyle would only speed this reversal. Because my focus today is on breast cancer and avoiding hysterectomy, I would like to share with you a brief overview of how breast cancer develops and why problems develop, making it necessary to have a hysterectomy. When a person understands the real cause or causes for any effect or condition, then the corrective solution becomes easier to follow. Breast cancer and all female reproductive problems develop in a similar manner. First of all, as children, we generally hold our fears abdominally. This contractiveness, along with eating junk foods, being exposed to chlorinated water and antibiotics, as well as dehydrating the intestinal tract by drinking soda pop instead of water, slows the intestinal flow, creating a condition of constipation. Constipation in any form causes a greater volume of toxic waste to recycle and begin to overwhelm the liver. Meanwhile, there's a two-way communication between the colon and the lower back. As constipation increases, tension develops in the lower back, slowly reducing the nerve flow from the spinal cord to the colon. As this nerve flow is restricted, the tissue of the colon contracts and eventually forms a stricture, which further inhibits the elimination of waste from the colon and compounds the overwhelmed condition of the liver, which, of course, is your main blood filter. Over the years, as the liver is being bombarded with toxic waste from the colon, the gallbladder, which is the liver's trash can, is also accumulating small masses of oxidized arterial plaque that the liver filters from the blood and dumps into the gallbladder for elimination. These masses cause a physical blockage in the gallbladder that reduces the liver's ability to release the waste it has filtered from the blood. By the time we're 20 years of age, most gallbladders are full of what would be termed sludge, which is an accumulation of arterial plaque. Between the enlarged gallbladder backing waste into the liver and the liver being overwhelmed by the recycled waste from the colon, it becomes impossible for the liver to keep the bloodstream clean. The wisdom of the body, observing the liver's inability to keep the blood clean enough, begins a desperate search for creative ways to remove toxic waste from the blood. The kidneys are the first solution for cleaning the blood when the liver gets overwhelmed. Although referred to as organs of elimination, the kidneys are actually chemistry regulators that function by eliminating urea and mineral excesses to keep the pH of the blood in proper balance. The kidneys were not designed to do the work of the liver. This transfer of labor from the liver to the kidneys is the most common starting point for kidney trouble and high blood pressure. When it seems that the kidneys are not capable of keeping the blood clean enough, the body wisdom responds in two ways. It tightens the muscles below the collarbones, restricting the flow of lymphatic fluids from being released into the bloodstream. It then redirects excess waste from the bloodstream into the reproductive area. The monthly period was designed to flush and clean the female reproductive body, not to clean the bloodstream. But out of desperation, the body wisdom deposits waste materials into the reproductive area for a monthly elimination when the liver isn't able to keep the blood clean enough on its own. When a woman uses tampons, or when any other reason exists for a light period, the body brilliantly develops little trash cans to store the waste that can't be released during the periods. These little trash cans are called fibroids, cysts, and tumors. The same conditions are also responsible for all female reproductive problems. The solutions for reversing these problems are quite similar to the solutions for reversing the causes of breast problems. Problems develop in the breasts years after the lymphatic system begins to stagnate. Now, if we take a close look at how our tissue cells function, we see that each cell draws nutrients into its cellular body. It performs an action, then exhausts an acidic waste. The lymphatic system is designed to wash this acid away from the tissue cells, carrying it up to the subclavicle vein, then release it into the bloodstream for the liver to filter and eliminate. Because of the back pressure in the lymphatic system, which is caused by the liver's inability to keep the blood clean enough, and the body's response by tightening the muscles below the clavicles, this forces the glands and tissues of the breasts to stagnate with acidic waste. This acid waste is stressful to the breast tissue. Before continuing with the explanation of what takes place after the breast tissue becomes stressed by this acidic waste, I'd like to share with you how the body naturally deals with an area that comes under physical stress. Every time there's a physical stress anywhere in the body's response is to saturate the stressed area with calcium, drawn from the diet or robbed from the bones. Calcium is the body's natural sedative for tissue stress and pain. And as a side note, this process of self-sedation is also the main cause for osteoporosis. After years of breast tissue being saturated with calcium to sedate the stress caused by the saturation of acid waste, the calcium begins to crystallize, causing sand-like calcium crystals to develop within the breast tissues. Between the toxic lymphatic back pressure in the breasts, the inflammation caused by the stagnated acid waste, and the blockages caused by the crystallization of calcium, the blood flow to the breast tissue becomes inhibited. When the blood flow gets inhibited, the breast tissue cells starve for oxygen, and when oxygen starvation hits a certain low level, the tissue cells are then forced to mutate and become cancerous. Our cells are determined to survive, and when starved for energy and oxygen, our cells will adapt by mutating rather than to die. As you hold a picture of this condition that already exists in the breasts of most women over 40 years of age, then imagine what it would be like to crush these vulnerable tissue cells into the calcium crystals that developed among these cells. Of course, damaging the breast tissue cells would cause immediate inflammation, which would stop the blood flow in some of the cells. If these cells were to be radiated immediately after being damaged, inflamed, and thereby starved for oxygen, you couldn't have a more certain formula for mutating these cells. In other words, when this natural congested and calcified condition exists in a woman's breast by the age of 40, to perform a mammogram will almost certainly cause breast cancer to begin. Unfortunately, from the day the first two tissue cells mutate, these cells would need 8 years of growth to become large enough for a mammogram to detect a tumor. For this reason, in an enlightened future, it will be illegal to perform mammograms on women. There are 2 ways in which I would like to help you to wisely care for your breast and reproductive health. First of all, I want for every woman to know about a completely safe alternative to the mammogram. You may have already heard of medical thermography. You may have even taken advantage of this technology for yourself already. If so, I congratulate you. The second thing I would like to do is to offer you a guaranteed solution for breast problems and female reproductive issues. Since I don't know how much you know about thermography and how much you don't know, I'll share with you what I feel every woman should know about this technology. First of all, thermography is completely non-invasive. It is as simple as having your photograph taken. The thermographer uses a special camera that detects heat differences in target areas of your body. This indicates both inflammatory patterns as well as blood flow restricted areas. Thermography has been recognized since 1982 by the FDA as a valuable diagnostic tool. It's also been recognized by the AMA Council on Scientific Affairs, the ACA Council of Diagnostic Imaging, the Congress of Neurosurgeons, and the American Academy of Physical Medicine and Rehabilitation. The reason for such recognition is the fact that thermal imaging is able to detect breast disease up to 10 years before any other procedure. With such advanced warning and with a plan for reversing the reasons a woman would develop breast cancer in the first place, there's absolutely no reason whatsoever for a woman to ever develop breast cancer. Thousands of people are donating hundreds of millions of dollars into cancer research with the hope that the pharmaceutical industry will discover an actual cure for cancer. What most people don't realize is, if the pharmaceutical industry provided a way to actually eliminate cancer, they would be destroying the most lucrative part of their business, the cancer treatment program. And it's important to remember, these are corporations, and if any officer of a corporation does anything to reduce corporate profits, the investors would have them fired immediately. So no matter how many billions of dollars are donated, and no matter how many people hope and wish for the elimination of cancer, the reality is the medical and pharmaceutical industry will accomplish this feat just shortly after pigs learn to fly. Until then, I'd like to present an offer that no adult woman should turn down. In order for you to have a clear and complete understanding of all levels of cause for why you may be developing any sort of health problem, especially in the breasts or reproductive area, I would like to invite you to contact our office and make an appointment for a medical thermography session and a full health screen and consultation. You'd begin by having thermographic photos taken by a certified clinical thermographer. These photos will be of your upper body and abdomen. Your photos will be studied by a doctor with specialized training in the interpretation of thermographic images, who will then prepare a report to interpret the meaning of the various temperature patterns captured by your thermographic images. This report will be sent to me, and I will review it with you to make sure that you understand what these patterns mean regarding your health. At this same time, I'll perform a dark field and HLB blood evaluation for you. This will provide you with a complete understanding of all levels of cause for the development of the inflammations and restrictions that could be developing into disease. As a bonus to this thorough evaluation, I'll provide you with the guaranteed plan for avoiding breast cancer and hysterectomy. Normally, the thermography session, along with the doctor's interpretation and report, would cost you $250, and the dark field HLB blood studies and consultation are normally another $150. And, of course, the guaranteed plan for avoiding breast cancer and hysterectomy is actually priceless. But we're putting on a special that will allow you to take advantage of the complete $400 evaluation package for only $250. Give our office a call at 714-485-2299. All right, thanks for listening. Bye now.